Hi everyone, my group is going to be going over autism spectrum disorder. I'm Riley and my group members are Morgan, Emily, and Michelle. So for the characteristics of ASD, it is a neurological and developmental disability. The primary characteristics include difficulty with social communication and interaction, which can make it difficult for them to pick up on social cues or maintain relationships. There is also difficulty with expressive and receptive language, but this varies. There can be individuals with ASD who have completely typical language or those who have severe deficits. And lastly, there are restricted interests or repetitive behaviors such as rocking or flapping of the hands. In terms of causes, there is no direct cause of ASD. It is believed to be a combination of genetic and environmental influences. So although there is no cause, research has found risk factors such as family history, especially in siblings and twins, other genetic disorders such as Fragile X, and also pregnancy and birth complications such as premature birth, low birth weight, or being born to older parents. As far as the incidence, it can be diagnosed as early as 2 years of age. Males are 4 times more likely to be diagnosed than females. And in the United States, the CDC estimated that over 5 million adults have ASD and that approximately 1 in 44 children are diagnosed. With ASD being a spectrum disorder, there are many subtypes. In the most recent DSM, 3 were identified. We have the autism disorder, which is your classic autism with all the 3 primary characteristics. Then another subtype is Asperger's disorder, which is more mild, has similar characteristics to autism disorder, but there typically is no language delay. And lastly, pervasive developmental disorder, which is known as the atypical autism. Characteristics are primarily in social and communication challenges, and this has fewer symptoms and they're also more mild.
Along with other disorders, autism has various types of intervention. Those include, but are not limited to, early intervention, applied behavior analysis, medication, educational interventions such as speech and occupational therapy. Early intervention allows individuals with autism to build and improve in developmental areas needed for daily life. The key here is intervening as soon as possible to allow these individuals to develop those skills that will help them be successful. Next is applied behavior analysis, also referred to as ABA. The goal in ABA is to increase desired behaviors while decreasing harmful behaviors that individuals with autism may engage in. Next is medication. This is a medical decision and there is no one right answer. Therefore, families must take the time and consideration to find the option that best fits their lifestyle as well as the needs of their child. Lastly is educational interventions. Speech therapy works to address challenges with language and communication. Occupational therapy helps individuals with autism focus on play skills, learning strategies, and self-care. Occupational therapy may be seen as early intervention because it focuses on those skills that they'll need throughout their life. Autism has the ability to affect language greatly. One area it can impact is phonology, which is the set of rules that governs the occurrence and distribution of phonemes. Phonology is specific to each particular language. In terms of autism, there's a lot of conflicting results within the literature. The fundamental speech sound behavior of these children is still not fully understood. Various research has shown atypical as well as typical phonological processes, disturbances in prosody, and limited consonant inventory. So the literature is showing that some students with autism may have atypical processes, whereas others have typical phonological processes. As Riley mentioned, it is a spectrum, so it has been noted that individuals with more global impairments may have more phonological difficulties. One significant area is atypical vocalizations. Individuals with autism produce significantly more atypical vocalizations than language matched peers, and those are often seen as high pitched squeals. Next, autism can have an impact on morphology, which is the study of the forms of words. Studies of morphological development in children with ASD are limited, but suggest that early acquired morphological rules are learned as effectively as children. In some research studies, it has shown that patterns are easier for individuals with autism. So, regular past tense verbs such as ed or present progressives are easier for them to predict. Therefore, they do well with those grammatical structures. Individuals with autism have better local processing as opposed to global processing, which is consistent with the weak central cohesion theory, which suggests that these individuals struggle to incorporate information at different levels and as a result fail to integrate detail into global entities. This means that these individuals struggle to look at things on a large scale and only focus on right now. So, as morphology gets more complex, they may see more difficulties in it.
For autism spectrum disorders impact on semantics. Semantics is the study of meaning and language, and it can be applied to entire text or to single words. Individuals with autism show difficulties in using sentence context to identify the correct meaning of ambiguous words such as homonyms. They often mispronounce homonyms because they disregard sentence context. Regardless of language ability, individuals with autism spectrum disorder tend to interpret speech literally. Affected individuals are also less likely to use sentence context spontaneously to correctly pronounce homographs, showing a tendency to pronounce the dominant meaning of a homograph, regardless of sentence context. Some research has indicated a broader weakness in processing information in context, sometimes referred to as the weak central coherence theory, which hypothesizes that individuals with autism have difficulties in integrating pieces of information to establish a whole meaning, showing a bias toward local rather than global processing. Now moving on to syntax. Syntax is the set of rules, principles, and processes that govern the structure of sentences in a given language, specifically word order. The few studies that have evaluated syntax in autism spectrum disorder have yielded conflicted findings. Some studies have shown that syntax in ASD is significantly delayed compared to the syntax of neurotypical individuals, but others have shown that syntax is a relative strength for individuals with ASD, and pragmatics is the area of greatest weakness. One study found significant impairments in certain items of syntax, such as making grammatical judgments or repairing grammatical errors, understanding pronouns or expressing them, retelling sentences or stories, answering logically using negation, expressing jobs in speech, using irregular plurals, using dualization, question formulation, and using past tense forms, and using words that describe physical state.
Pragmatics is using language in social context. How do we produce and understand language within the context that we live in? Social pragmatics is usually cited as a core challenge for individuals with autism spectrum disorder. This is usually shown because they tend to have difficulties with loudness and tone variation. And so maybe they speak more monotonely, inappropriate timing. And so they may come into a conversation midway, or maybe they come into a conversation uninvited, inappropriate topics. So for example, I used to be a special education teacher, and I had a student with autism one day come up to me and told me on a day that I didn't wear makeup that I looked better with makeup. And so socially, that's not appropriate to tell your teacher that. And he was already in 8th grade at the time, so he should have known that that was not okay within the context, but he really struggled with understanding what topics was appropriate for a certain situation. Another thing is that they may struggle with figurative language, such as sarcasm. So we talked about ASD's impact on pragmatics. Now let's talk about what is it about their brain that makes it so that people with ASD tend to struggle with pragmatics. So the theory is that the brains of people with ASD have deficits in the mirror neuron system. And early MNS dysfunction is believed to be the culprit for the deficits in the theory of mind observed in ASD. Another thing is that people with ASD really struggle with sensory overload. This is because the brain is firing so much and there's a lack of a system to help organize it. And actually the main reason why we know that people with ASD have deficits in the mirror neuron system is because when people with autism try to interpret faces, there's hypoactivation in the inferior frontal gyrus. So how does this relate to pragmatics? Basically, deficits of theory of mind and sensory overload make it really, really difficult for people with ASD to understand facial cues. Thus, they struggle to interpret social cues and norms like loudness modulation, timing, or figurative language, or the other things that we talked about. Possible treatments that may help with pragmatics may be turn-taking activities. So turn-taking activities can increase understanding of theory of mind. Actually, a study showed that a child with autism that better understood theory of mind showed that the deficits within the mirror neuron system actually decreased. So they're very, very closely related. And so we also want to give them visual supports and simple, direct language to simplify and help organize information. Remember, they have that sensory overload. Now let's talk about some interesting facts about autism spectrum disorder. Sperm age matters. Spontaneous mutations are known to accumulate over time, and this has led some researchers to believe that mutations explain why men aged 50 or older are actually twice as more likely than men under 30 to father a child with autism. Contrary to media representation, people with autism can also be very creative. In the Netflix show Glow Up, I don't know if you guys have seen it, Sophie Braverstock, a person with autism, won the makeup competition, showing that they really can be phenomenally creative. There's no link between vaccines and autism. In the following years, many studies were conducted over 10 million children and found that there was no link between vaccines and autism. Only 20% of individuals with autism actually participate in the labor force. And a lot of them actually do not even qualify for government assistance because they have what is called an invisible disability. And so they're so high functioning that they are perceived to not need any government assistance, but they still are lacking that pragmatic skill. And so it makes it difficult for them to hold down a job. This is the most interesting fact that I think this is the most interesting fact. And it's actually that people with autism tend to have larger brains. And so several studies have reported that individuals with autism may have larger brains than neurotypical individuals. A theory is that people with ASD have increased cortical excitatory neurons potentially, and this is potentially leading to a larger brain mass. So I hope you enjoyed our presentation about autism. Bye.